Hi, I'm Dr. Tom LaGrelius, a family physician and geriatrician in Southern California with AAPP. And we're going to talk to you today about urinary tract infections. Again, one of the commonest problems that primary care doctors see in their offices. For some reason, and I'll tell you why, urinary tract infections are far more common in women than they are in men, and they're also fairly common in older men. And the reason for that is that in women, the urinary tract exit is very short, it's an inch or two long, and it empties into an area that is populated with large numbers of bacteria. Often bacteria that come from the rectal area can easily get into the area around the urethra and then climb back up into the urinary tract through this very short urethra. Whereas in men, there's a little better plumbing system and it's less likely to get bacteria up into the urinary tract. And the other reason that people get urinary tract infections frequently is they don't empty their bladders completely. Just imagine for a moment, I'm going to draw a little picture of a urinary bladder, okay? And let us say that urinary bladder has 100 cc's of urine in it, and that there happens to be one bacteria per cc in the urinary bladder, and that means that there's about 100 bacteria in the bladder. And if you empty your bladder all the way down so that it's completely empty and there's 0 cc's left in there, let's say there's 1 cc left in there, there's only going to be 1 bacteria left in the urinary tract. And then when the bladder fills up several hours later and gets back up to be maybe 300 cc's, there's only 1 bacteria in that whole urinary bladder area, and it's very unlikely for the bacteria to multiply. Let's say the bacteria increase in numbers once every half hour. They double in size, and it takes a few hours for the urinary bladder to fill. You may only end up with maybe 10 bacteria in that 300 cc urinary bladder. But let us say you can't empty the bladder, and it only empties down to like 50 cc's. And then you're going to have 50 bacteria in that bladder, and over the next several hours you might end up with 1,000 bacteria in the bladder that's 300 cc's full, and pretty soon you've got more and more and more bacteria. So it's very important that you empty the bladder completely every time you urinate to reduce the risk of urinary tract infections. The commonest bacteria to cause urinary tract infections is the E. coli bacteria. And you've probably heard of E. coli bacteria, and you think of them as being very dangerous because they've been associated with epidemics in meat products and so on. But actually E. coli is the commonest organism we have. Your intestinal tract is just full of it. Billions and billions of E. coli, normal ones that really don't bother you very much. But when they get into the urinary tract, they can cause serious problems. So, the key ways of avoiding urinary tract infections are, one, to keep a lot of fluid flowing through your urinary tract. So it's a good idea to perhaps drink extra water if there's no other reason you shouldn't do that. To make sure your bladder empties completely after you urinate each time, to make that special effort to get the last few drops of urine out of your bladder each time you empty it. And sometimes it's a good idea to acidify your urine because the bacteria don't grow well in an acid urine. And you can acidify your urine with simple acids like vitamin C. So if you tend to get urinary tract infections over and over again, acidifying the urine with a little vitamin C every day is sometimes a good way of preventing them. How do you treat them? Well, you know, in reality, most of them will go away on their own if you just drink lots of fluids. But if the symptoms are bad enough, we often use very short courses of antibiotics. We'll often use sulfa drugs and Cipro in very short courses, a few days, 5 days, 3 days, 7 days. Will often eradicate most urinary tract infections. Urinary tract infections can become very complicated. They can create infections in the kidneys. You can get bacteria spreading into the bloodstream and get urinary sepsis that goes all over the place, and they can require hospitalization and be very serious. So they shouldn't be ignored. And you should take these urinary tract symptoms to your physician to try to get things under control if they become frequent or recurrent. Thank you.